Obesity is a complex, chronic disease characterized by excessive body fat accumulation that presents a risk to health. According to the World Health Organization, WHO, obesity is defined as having a body mass index, BMI, of 30 or more, calculated by dividing a person's weight in kilograms by the square of their height in meters, kg/m². While BMI is a practical tool for population-level assessments, it does not distinguish between fat and muscle mass, nor does it account for fat distribution, factors that also significantly influence health outcomes. Obesity has reached epidemic proportions globally, affecting over 650 million adults and increasing in prevalence among children and adolescents. It is not merely a cosmetic concern, but a major risk factor for various non-communicable diseases, including heart disease, type 2 diabetes, certain cancers, musculoskeletal disorders, and even psychological issues such as depression and anxiety. The causes of obesity are multifactorial and involve a combination of genetic, behavioral, environmental, physiological, and hormonal factors. Fundamentally, obesity results from an energy imbalance, consuming more calories than the body expends over time. However, this simplistic explanation masks a deeper interplay of influences. Genetic predisposition plays a significant role. Studies have shown that genes can affect hunger, satiety, metabolism, and fat storage. For example, mutations in the leptin gene or its receptor can lead to severe early-onset obesity. Still, genetics alone cannot account for the rapid rise in obesity rates over recent decades. Environmental and lifestyle changes have played a central role, particularly the widespread availability of calorie-dense, nutrient-poor foods and increasingly sedentary lifestyles driven by technology and urbanization. Modern diets, often high in added sugars, saturated fats, and ultra-processed foods, contribute significantly to excess calorie intake. Sugar-sweetened beverages, fast foods, and large portion sizes have become dietary staples in many societies, promoting weight gain. On the other hand, physical inactivity has surged with the rise of desk jobs, screen time, and a reduction in opportunities for active transport or recreational exercise. Sleep deprivation, stress, and certain medications such as corticosteroids, antipsychotics, and insulin can also contribute to weight gain by affecting metabolic rate and appetite regulation. The health consequences of obesity are far-reaching. It is a leading cause of preventable death worldwide. Obesity substantially increases the risk of cardiovascular diseases, including hypertension, coronary artery disease, stroke, and heart failure. Excess adipose tissue, especially visceral fat, is metabolically active and contributes to insulin resistance, a hallmark of type 2 diabetes. Obesity is also linked to dyslipidemia, fatty liver disease, gallbladder disease, gastroesophageal reflux, and respiratory problems like obstructive sleep apnea. Furthermore, it increases the likelihood of developing at least 13 types of cancer, including breast, colon, kidney, and endometrial cancer. Beyond physical health, obesity can severely impact mental well-being. Stigma, discrimination, and low self-esteem associated with being overweight can lead to depression, social isolation, and anxiety, creating a vicious cycle that further impairs healthy behavior. Diagnosis and assessment of obesity go beyond BMI. Clinicians may use waist circumference to assess abdominal fat, which correlates strongly with metabolic risk. A waist circumference over 102 centimeters 40 inches in men and 88 centimeters 35 inches in women indicates increased risk. Tools like bioelectrical impedance and DEXA scans offer more precise measurements of body fat percentage and distribution. In clinical settings, evaluating obesity involves a comprehensive approach: screening for comorbidities, assessing dietary and physical activity patterns, exploring psychological factors, and understanding the patient's motivation and readiness to change. The cornerstone of obesity management is lifestyle modification, centered on dietary changes, increased physical activity, and behavioral therapy. A structured, calorie-controlled diet with a deficit of 500 to 1,000 kcal per day can result in a weight loss of about 0.5 to 1 kilos per week. Evidence supports dietary patterns such as the Mediterranean diet, low-carb diets, or plant-based diets for sustainable weight loss. Emphasis should be placed on whole foods, fruits, vegetables, lean proteins, whole grains, and healthy fats, while reducing intake of sugars, refined carbohydrates, and saturated fats. Physical activity recommendations for weight loss include at least 150 to 300 minutes of moderate intensity exercise per week, such as brisk walking, swimming, or cycling. Resistance training is also important to preserve lean body mass during weight loss. Behavioral therapy plays a critical role in supporting long-term adherence. This includes self-monitoring, e.g., food and activity logs, setting realistic goals, cognitive restructuring to challenge negative thoughts, and stimulus control techniques. Group-based interventions, apps, and digital health tools have shown efficacy in maintaining engagement. In some cases, pharmacotherapy may be appropriate for individuals with a BMI, 30 or 27 with obesity-related comorbidities who have not achieved weight loss through lifestyle changes alone. FDA-approved medications like orlistat, liraglutide, a GLP-1 receptor agonist, semaglutide, and bupropion naltrexone target appetite regulation and fat absorption. These medications are most effective when combined with lifestyle interventions and under medical supervision. For individuals with severe obesity, BMI or 40 or to 35 with comorbidities, bariatric surgery may be considered. Procedures like gastric bypass, sleeve gastrectomy, and adjustable gastric banding have shown significant sustained weight loss and improvement or remission of conditions such as type 2 diabetes, hypertension, and sleep apnea. However, surgery is not a cure and requires lifelong lifestyle changes, nutritional supplementation, and follow-up care. It is important that patients undergo thorough preoperative assessment and postoperative support to optimize outcomes. Preventing obesity is as critical as treating it and requires coordinated efforts at individual, community, and policy levels. Public health initiatives should focus on promoting healthy eating and active living through education, urban planning, like parks and walking paths, and policy changes such as taxation on sugary drinks and clearer food labeling. Schools and workplaces should provide environments that support healthy behaviors, and healthcare systems should integrate routine obesity screening and counseling into practice. At the societal level, addressing food deserts, income disparities, and cultural attitudes toward food and body image is essential to creating equitable health outcomes. In conclusion, obesity is a chronic, relapsing condition that requires a compassionate, evidence-based approach. It is not merely the result of personal failure, but a medical condition influenced by complex biological, psychological, and environmental factors. Successful management depends on long-term strategies tailored to individual needs, supported by medical professionals, communities, and policies that promote health. With early intervention, consistent support, and a multidisciplinary approach, it is possible to prevent and treat obesity, reduce its associated risks, and improve quality of life for millions of people around the world.